Good afternoon, everyone. Welcome to the State TA Day webinar. Can someone confirm that you can hear me and see my screen before we get started, please?
Rick says he can hear and see you.
Thank you, Rick. Okay, we're going to go ahead and get started. Stacy Kennedy's here with us today, and she will be introducing our first presenter.
Hi, everyone. I'm pleased to have with me today Trish Leakey. Trish is the Auxiliary Service Manager with the Colorado Commission for Deaf, Hard of Hearing, and Deafblind here in the Department of Human Services. Trish is here to talk about recent funding that was received from the Joint Budget Committee this past session, where there's some exciting things that will be happening to better support individuals who are deaf, hard of hearing, or deafblind and in need of interpreter service. And one of the components of the recommendations from the Joint Budget Committee actually includes early childhood councils. So we wanted to use some of the agenda time today to talk about the broad effort and then kind of hone in on the specific vision for how councils will be a part of this effort, and then provide some information on some town hall meetings that will be coming up here in the next few weeks, and where we'll be asking for some support for you all and just helping to get the word out so that these town hall meetings are well attended and really provide good information so that it can inform the efforts of the Rural Interpreting Services Project pilot. So Trish, I will pass it over to you. I wanted to let everyone know that Trish is actually presenting using an interpreter. And so the voice you'll be hearing is the voice of the interpreter. And you may hear some pauses so that we don't wear out the interpreter hand. So anyway, thanks so much. And Trish, I'll pass it on to you.
Great. Hi, everyone. This is Trish speaking. I just wanted to add a little bit about the interpreter so it helps all of us. If you want to speak, if you could just identify yourself. Let's say you have a question, just understand so that I can understand better who's speaking, because I'm not hearing what's happening. Just identify who you are. And just feel free to interrupt me at any time if you have any questions, any comments. I'm open to that, so that's okay with me to interrupt. Okay, well, thank you so much for giving me this time today. We just started a new project. It is called RISP, and it stands for, I'll explain a little bit what that means and what it stands for. But first of all, I wanted to introduce to you what the Colorado Commission for the Deaf and Hard of Hearing and Deafblind, and what that means. So have any of you heard of the Commission of CCDHHDB before? Are you familiar with that?
This is Monica. Everyone, remember to, if you want to answer Trish or type in any questions, use the chat box or the question box, please. Thank you.
Okay, so is anyone familiar with our organization, our group?
We have
a great opportunity to meet each other, so.
Yes, Trish, this is Monica. We have quite a few people typing in that know they have not heard of you guys.
Okay, wow. Okay. Well, that's great. I'm really happy to be able to meet you and to tell you a little bit about us. Our commission, it's quite an acronym, CCDHHDB. It's quite awkward, but to say that. But I'll try to kind of include. It includes different groups within the community within that commission. So. CCDHHDB. My job here, I have a coworker with me as well to let you know. His name is Timothy Chevalier, and he is going to kind of explain a little bit of our broad spectrum about what we do in the community, so you're aware of what our commission is all about. And then you can go ahead and click the next slide, please. Monica is helping me with the slides because it's a little bit difficult for me to watch the sign language interpreter and take care of the computer screen and all that at the same time. So I've asked her to monitor that for me. And so thank you very much, Monica, for doing that. And she's going to also watch who's typing in the chat box for me as well. Same idea. I can't watch both things at the same time. So she's going to let me know when there's questions. So I'm going to pass this over to Timothy right now, and he'll just briefly explain the different programs that we offer, so you can kind of see on the screen too, the slide. It shows a few of them that we have here. So Timothy? So I think I'm going to just take a little bit of time to talk about some of the projects that we have, and then I know we're going to focus on RISP. But I just wanted to go through some of these really quickly. We have Communication Technologies Program, and that's where we distribute phones to those who are either low income or need some guidance or meet the guidelines for that income. And it's to assist their communication. And that includes phones with captioning. It has also a third party so that someone is typing and they can hear and pass on the information. Then that person will read and then speak for themselves. So there's kind of a three-way situation on there. And different phone devices that have different technology for those that are deaf or hard of hearing. For deaf-blind individuals, we have assisted devices as well. We have a coordinator for the deaf-blind services, and they use SSP, which means a support service provider. And an SSP is someone who can help make that deaf-blind person aware of their environment, what is happening around them. They can help them to accomplish different goals. Maybe they need to speak to another person, like maybe have someone that's hard of hearing that is speaking softly. Maybe they need to know what that's happening, so they'll be aware of any expressions or tone, or someone sleeping during a presentation, or whatever it may be. If someone has just come in the room, if there's laughter, they let them know of all those environmental cues. And then that person, deafblind person, there's someone that sits in the back who can also provide cues and signals for other information that is happening within that environment to that SSP. So we do have a program that's available for applicants as well to be a service provider. They can be deaf, hard of hearing, and there's a variety of ways that they can get involved. Then we also have the legal services. Some of that is what Trish is involved in. And then we have interpreters that go to court. We have county and state interpreters. And then we have the RISP program that was added to that. So for the interpreter services in the rural areas. So that's specifically, Trish can talk more into that detail later. We have some outreach services, as well as we can provide training and consultation, and we can kind of consult and train about different programs, getting access to those different programs. Maybe for a boss that's at work, maybe something environmental, just to consider the cultural aspect for the stakeholders. And we can also, there's sometimes cultural conflicts that come up, and people need to just kind of become aware of those and how they can kind of interact within those settings to improve those conflicts. And also that includes the ADA law and how to abide by that, how to have, advocates involved in that can kind of change the situation as well and improve the access for clients. And the RISP services is attached to that. So I will pass that over to Trish.
Thank you. This is Monica. We do have one question from one of our participants. The question is this only for early childhood or is it broader, including senior citizens? And I'm assuming they're talking about the RISP pilot.
Okay. Yeah, this is Trish speaking now through a different interpreter. All of our programs are for the general public. It's not only limited to early childhood. No. So
this is Monica. We're having some trouble hearing you.
Okay, hold on. Can you hear me now? Can you hear me now?
Much better. Thank you.
Much
yes,
better.
We can.
Okay, sorry, we muted it. So we're going to say that again. This is a new interpreter's voice, just so you're aware. And Trish, can you say that again? Explain the answer again. She's saying the services are for all ages. To my understanding, it's not only limited to the early childhood or to children, but in general to all ages. And RISP itself, it's the same thing. That is also open to all ages and all age groups. And this is Tim speaking right now. This is about providing interpreters for kindergarten through 12th grade. That's what we're going to talk about later in the presentation. So, are we ready to go ahead and go on to the next slide? Are we ready to go on to the next thing?
Yes.
Okay, perfect. All right, thank you. Now, Stacy went ahead and explained the JBC, the money that is invested for our commission to have been set up, the RISP project. And this slide here shows you specifically what the JBC wants to accomplish. There's 3 different requirements. All of them are, with a $700,000 investment for a 2-year trial. The first one, the money is for interpreting services, and that money has been invested for $440,000 of that $700,000. So now you can go ahead and see your names are there. Basically, the ECC is indicated, and you'll notice that ECC is mentioned. And that makes it possible to find it's a good place for staff interpreters to be put into different situations. There's 8 different places that they can be put into, and it's in coordination with ours and your agencies together in partnership. And then the second thing is we give training and scholarships for interpreters to go ahead and encourage them to become interpreters, because we need more interpreters in the state, specifically out in the rural communities where they have very few interpreters. And there's $200,000 there to, go ahead and help interpreters become certified. And then the last is the outreach program, that is $60,000 that we have set aside for that. And that means it will be sent, to people that can go ahead and make contact with those rural areas and let them know about the RISP and the interpreting services and the training and everything else that we're doing to help their communities. The outreach is there to help set up conferences, meetings, town halls, that sort of meeting from, 8 different meetings that we want to set up in different communities. And some of the rural people have given us feedback that they don't like, the whole idea of town hall, because that's a political term. It sounds too political, and their response is they don't want to go ahead and, be involved in like campaigns and that sort of things in politics. And they try to explain that we want to like change the wording to maybe call it, a community meeting or, something to involve community, and where we can share information, ideas, and the RISP program, and tell them what the opportunities are for that. So, is there any questions so far? I know that
Yes.
I'm going to be explaining more later on. Yeah, go ahead, Monica.
This is Monica. We have one question from a participant. It says, are you also working with colleges or universities that might have an interpreter service or degrees?
Yes, this is Trish. I will be covering that fairly soon in my presentation, if you wouldn't mind holding on to that question until I cover it.
This is Monica. That sounds good. We do have another question, if I can go ahead and ask that one.
Okay, go right ahead.
It says, our Boulder High School has an ASL program. Are there any language programs in rural high schools you are working with?
Yeah, this is Trish speaking. I have heard about several high schools that do have ASL curriculum in their school that do include, and that includes out in the rural areas, but I'm not exactly sure where they are located. I know that Tim Chevalier has more information about that, and Tim's speaking now. He's saying, so the colleges that recognize ASL as a world language for world language credit towards university requirements are being seen more and more throughout the United States. Now, understand more frontage. Okay, front range. And they have, there's a few out there that are more in the community. They're bigger communities that provide those classes, and then some of the more distant rural communities do not have them, unfortunately. Sorry to say. Okay, and I also wanted to add, this is Tim again. Now, the University of Northern Colorado has set up instruction in ASL as a master's level program, and they're trying really hard to recruit more teachers who will stay in state, I'm hoping to see more teachers in state in the future as a result.
Thank you so much. That's all the questions that are listed now.
Okay, great. This is Trish now. Now, Monica, if you wouldn't mind bringing up the next slide. The JMC provides money to encourage and certify interpreters and interpreter access. And we don't have a lot of data to figure out where the need is all out in the outlying communities throughout the states, in the deaf communities, the hard of hearing, the deafblind, what sort of services they're getting and where. And they use sign language, using sign language to go ahead and pay for interpreters, people, and where the people are using sign language. We're trying to figure out where those people are located. And so it's kind of an investigative process to try to figure out where our focus needs to be, where our attention needs to be placed. And the ECC and the staff interpreter idea, we're not exactly sure how to implement it yet because we don't know exactly where to place the staff interpreters. So we basically need to gather more information about where deaf people's needs are. And so we're investigating and for more data. And I can tell you right now, it's not an easy process. We're finding 3 different sources so far. And the first being what Tim Chevalier mentioned with the CCHDHHDB services, the program, the RISP program, providing interpreters for all 22 states in the judicial districts. So what we're doing is we're looking at the data, looking through it, and trying to figure out where we're seeing requests for interpreters come up. And the top places are all here on the slide. The first one is Grand Junction, Pueblo, and then Bent, Crowley, Ontario County, and that's just one district there. And then the other district is Chaffee, Oster, Fremont, Park County. And that group is Clear Creek, Eagle, Lake, and Summit counties. So we're trying to look and seeing if we can go ahead and remove the Front Range, leaving the top requirements for interpreters out in the rural areas, and they're maybe giving us some hints as to where the deaf community lies within those areas. But it's very, very limited data because they're usually people that are in trouble and in court as a result. And so hopefully that doesn't mean that deaf people are, troublemakers. They're just the ones that are requesting the interpreter or requiring the interpreters out there. So what we're doing is we're trying to get other data from Stacy Kennedy's group and our census map, and that's one of the attached handouts that I gave you. Monica, would you mind putting up that map that's attached, please?
While I find the map, would you mind answering a question we have?
Yeah, sure, that'd be fine.
It says, why is the Front Range excluded?
Well, the JMBC focuses on rural, and we're trying to follow that mandate. And the other slide, I'll go ahead and talk about what rural means as far as what are we considering right now. Rural normally means how many people live in the area, and that tends to be how the census looks at an area, like $2,500, I'm sorry, that's an interpreter mistake. 2,500 people or less in a community is considered rural. And that really isn't the same as what you would find in a deaf community. So what we're looking at is accessibility to interpreting services. And so that's a little bit different of a definition for rural. and if you can see, I included Grand Junction as well as Pueblo. And those two are fairly large places that you can agree, but as far as interpreting services, there's really poor access out in those two communities. Communication is poor. Pueblo has no certified interpreters. And Grand Junction, if you take a look at the certified list there for National Interpreting Agency lists of interpreters, there's one out in Grand Junction, one certified interpreter. And we know that there's two more, but they aren't in business anymore, so they're not working. And so for us, for our ISP, we consider all the we exclude the Front Range, and then we have many interpreting agencies there. That's Front Range, is because they have so many interpreters and agencies. Okay, Timothy is going to go ahead and add something else. He wanted to add something to that answer. So to answer your question, the reason behind JBC and the RSP project is that we've heard a lot of concern about a lack of qualified interpreters in the rural areas. The Front Range areas have a lot of interpreting services. They have plenty of interpreters. They're not experiencing the problem. And the rural places are. So maybe a deaf person needs to go to see a doctor for a serious appointment, but they don't have a sign language interpreter or a lack of a qualified interpreter. And Colorado only recognizes interpreter, or, as far as the state law itself, is to have certification from the Registry of Interpreters for the Deaf. And other people who express themselves as sign language interpreters without that certification are considered fraudulent. So, that being said, the result of having an unqualified interpreter for, let's say, a serious doctor's appointment can have huge ramifications, horrible ramifications. And so basically, the legislature has wanted to address that gap, and that's what we're doing. Okay, and we're going to hold because we're going to do a switch of interpreters. One moment, please.
All right, we're back. Go ahead. So this is Trish speaking. Also, to be honest, everyday business workers here, we send interpreters all over the state for legal program and for any area outside of Denver, Colorado Springs. We'll send the interpreters, and so they drive to those services, and we can send them to Grand Junction, and that takes 4 hours to get there. And the interpreter, might work 2 hours, and then the interpreter has to drive back that 4 hours home. So, that takes up their whole day. So that tends to be very expensive to pay for that interpreter's time. Plus, you're paying for their mileage there and back. So that's why the legislature has seen, that's, the burden of the responsibility of cost and to those rural communities. Are there any other questions?
This is Monica. We don't have any other questions for now.
Okay, this is Trish. I see the map now has come up on the slide. Thank you, Monica, for finding that. This map is from Stacy Kennedy's group, and they have looked at the census data, and there is one question on the census which asks a person, are you identified as having hearing difficulties? So that's the question. Do you have hearing difficulties? And we've pulled that data from that question to try to find out where people have said, yes, I have hearing difficulties. And so that is a map. That's what you're seeing on the map right now, is that question. And so it shows ECC right here. You can see at the bottom right, there's a table and there's a name, and it says listed there ECC is the first one, which says Bright Futures. And there is a total of 3,837 people that say they identify as having hearing difficulties. And so this map kind of gives us some idea of where the services are needed, kind of gives us a better picture. But the problem is that means, maybe people don't use sign language. They have hearing difficulties, but what does that actually mean? Maybe they have just a small limit, or maybe they are deaf and they use sign language fluently, or the point of that RISP services is interpreter services. And so we need to make connections with those people that use sign language to communicate specifically. So that map does help us. It gives us a clue, but it's still not quite a full picture of where we are needing to focus and pay attention to. I am wondering if, as you look at this map here, does that seem like an appropriate kind of picture of your experiences, like ECC? Does this look about right?
This is Monica. No one's typed in anything yet. If you want to answer Trish's question, please type in the question box or chat box. Thank you.
This is Trish. I'll wait just a few seconds, give people some time. And the interpreters a break.
Trish, did you want to repeat the question for everyone?
Sure. I was just wondering if those of you that live in those areas on the map, and you identify ECC, do you feel that this map is accurate? Does it paint a picture of your experience and what you've seen within your areas? Or do you feel like you're not sure? Or what are your thoughts on what this map represents?
This is Monica. We do have one question. It says, hold on one second. I'm looking for the question. Okay, the question says, is that number all ages? It is under the ECC coverage area, but not necessarily fall within the early childhood age range.
This is Trish that's talking. That's a good question. Good point. My understanding is this is all ages. And maybe Stacy, do you know more details on that number for sure?
Hi, this is Stacy. Yes, it is all ages.
And this is Trish talking again. Maybe you are all just focused on children and used to that, and so less familiar with the all ages category. So maybe that's what's happening here on the map.
This is Monica. We do have a question. It says, where can we find our county population number for people with hearing difficulty disability?
This is Trish talking. I'm looking at the colors show the number of, if you look at your county, You can look at the color codes that match, and that kind of gives an idea of the number. Looks like the light yellow means it's between 0 to 83 people. The darker color means there's more people. And if you want some more information, the data source is on the map. On the second to the right box there on the right, the second box down on that right hand side, there's the data source there. So you could look there for some more information. And also, can you see the blue areas? That is the front range that we've taken up because we're not considering these on the map. So we don't, it's not going above and beyond the number of people.
Trish, this is Stacy. I just want to kind of remind folks, we're getting a lot of comments about the map representing populations beyond the age of 8. And Trish, we've talked about this. Early childhood councils support the birth to 8 population. We know you support the birth to 8 population. The reason early childhood councils are hearing this information today is really based on the mandate of the Joint Budget Committee. So we need you all to kind of open your minds a little bit and think about the possibilities of the benefit to the community as a whole in cases where we find that there is a need in the community, and how the Early Childhood Council can partner, knowing it's a broader age range, it's birth to death, essentially. But I do think this is an exciting opportunity to think about how we try and put these interpreters in areas where we know that there's a need. One other thing, and this is Stacy again, the map information, just as a reminder, is based on the census data, so it's really limited to those individuals that provided a response through that process.
This is Trish speaking. I would like to add too about the just the deaf world and deaf community. Many deaf kids born have hearing parents, and so they don't know much about what to do. They have a deaf child now. How do they communicate? How do they get them access to the world? And you know, the list goes on. So ECC might be, they play a big role in supporting that family and the education system as well. RISP, the RISP project, it's possible they could play a role with the child and the family as well. Kind of a collaboration with all of us together.
This is Monica. We do have a question. I'm asking what the parentheses are after the numbers.
Sure, this is Trish speaking. That number, I think that number is the number of the census that it tracks within that category. That is my understanding.
This is Stacy. We can get some clarification. Kwan, who developed the map, isn't with us. And so as part of the follow-up to this call, we can provide clarification for that question. Thank you.
And this is Monica. Trish, we just have another comment. It's from one of our participants. It says this is an exciting opportunity for partners. And I think we can move on with the presentation.
Okay, thank you. This is Trish speaking. The last data is we interviewed some people and to get their experience where the rural needs are. And so we have Mesa, one moment. So Mesa, Garfield, Montrose, La Plante, Pueblo, Montruba, Montezuma, and Moffett. So we have all of these counties that we've identified on this list. So it's just really if we were looking for just information about where the needs are in these different counties. So we did get some ideas back from these interviews, and we've provided a list on the slide for and what rural, like I spoke about before. We're going to skip that one actually. Okay, so now I'm looking at the webinar, and it looks like it's still on the map. So let's change that to the next slide. There we go. Okay. So, yep, we'll be on this slide. Okay, so page 7. Okay, so I'll go ahead and talk about the scope of the RISP services and what that means.
Trish, this is Monica. Is that the next slide?
Yes, yeah. Yeah, to number 7. Yeah, the scope. One more. There we go. Yep, that one. Thank you. Thanks. Okay, so I want to emphasize this is just sort of a, testing period. Things are going to change. This isn't set in stone yet, and how we're going to do everything. This is just sort of a trial and kind of just to see where we need to kind of tweak things. It will change. So, maybe the scope will change areas or, various things will change as we go along. So now the JBC wants to cover medical, education, support services, and community services. So there's 4 areas they want covered. And so what is not covered is pre-K to 12th grade. So the school, educational interpreting, is not covered in that. So they've already covered that through school districts. So that's a separate issue. That's not part of the RISP project. But sometimes parents that are deaf want to communicate with the teacher or the principal or someone at the school, or they want to be involved. They can be a part of the RISP project and get an interpreter through that program. Sometimes school districts refuse to provide interpreters for parents for meetings or some other way. The RISP program is available to provide those support services for that occasion. So that might be important for, an area of focus for us. And right now, RISP is not covering college and universities. But I want you to understand those tend to be covered by federal funds, so that's why it's not included. JBC is focusing on just the money that's in the state to support the state itself. So now I want to talk about you, ECC, and partnering with RISP for staff interpreting. So JBC envisions that we will place interpreters at ECC itself, but we don't know where that will be. So our plan currently is to use freelance interpreters and place them in situations for the next few months. And we're going to keep track of that data. Where are the requests coming from? Where do we tend to send the interpreters that will help us identify where to be placing those staff interpreters. We are currently, right now, we are getting interpreting requests, and so far, it seems it's coming from the Southwest, and that's so far, but we have, 7. It's very small number of data, but, we can't quite jump into, any decisions with that yet, but that's kind of what we're seeing, and we're just keep collecting that data. So what the future holds, that maybe we will contact you, maybe do a pilot, testing, putting our staff interpreters in place at your ECC to see what happens. That's kind of a later topic, though. For now, we're just focused on the next few months, and we're working on the freelance interpreters and collecting the data for those requests. Are there any questions? And while we're waiting for the questions to come up, we're going to switch interpreters. One moment.
Okay, this is Monica. We don't have any questions.
Okay. All right. And I'll just briefly touch on training, the training plan. And we partner with the UNC, the University of Northern Colorado, and they have ASL interpreter study programs there. So it's ASLIS. And we went ahead and spoke with them, and we've been partnering with them and providing scholarships. Okay, sorry. The scholarships for their ITP and their programs for training, and it's in the early stages right now. It isn't really to where we want it to be, but we're focusing on that on a later date. And then we also are planning to provide paid mentorships, experience, that sort of thing, for students that are learning to become sign language interpreters who are just recently certified but want to gain more experience, and that's our goal with that. So also the scholarships, you realize they haven't been completely set up yet, but we're doing service requirements. So for students who get, say, I said scholarship or a mentorship or anything like that from RISP or RISP, then they have to, in exchange, work out in the rural communities for a time equivalent to the support that we've given them. So one semester of scholarship means one semester worth of time working out in the rural community. So that's slide 9. I'm sorry, I forgot to tell you I wasn't paying attention. We're a little behind. So Monica, would you mind going to the next slide, please? Okay. Now on here, the next one. Okay, perfect. All right, thank you. This is, remember the 3 different things from the JBC. First of all, they want interpreting services. Second, they want the training. And the third thing they want is outreach. And currently, we are looking for an outreach person, a person who would be responsible for developing educational material for the RISP, to publicize, to create partnerships, to work with the people out in those rural communities. And that person would be responsible for taking on all 8 community meetings, those quote-unquote town halls. And they'd be responsible in coordinating the schedule and to set up those meetings so that they would happen. And now the next slide, please. Monica, would you mind going to the next slide, please? the community meeting, if you go back one. Okay, there you are. Thank you. Now that talks about what the goals are for the community meetings. What we're planning on the goals, there are different goals for different places. So if you can see on the list, Alamosa, Durango, and Grand Junction, Glenwood, Pueblo / Cordway, and Fort Morgan. Those so far are ones that we've identified. So they're probably where the meetings will be taking place, plus we're looking for one more place. And the schedule's going to look like hopefully late September going through November. We're going to try to set up all 8 of those meetings. And we will have 2 different meetings the same day with different target audiences. The first being for the general community, the stakeholders. And then that way they can see, the medical, the police, the sheriff, the fire department, the different agencies in the county, plus things like mental health facilities, the municipal court, and so on. In general, the school districts and the schools will also be able to attend. They'll be invited. So we have all these different communities that probably need sign language interpreters to have successful access for their deaf and hard of hearing and deafblind people. So that meeting will tend to take place in the afternoon. And then the second meeting, which is going to be a different target audience, is going to focus more on the deaf and the hard of hearing and the deaf-blind communities. Those meetings tend to be a little bit later on in the evening, and that way we can go ahead and address both audiences to what their needs are. So that's why we want to it's more successful to set up those meetings separately. Okay, and then on the next slide, please, Monica. I'm almost finished. I just wanted to go ahead and ask you all for some help from the ECC. Please help us. You're most aware of your rural communities. You are a part of those communities, and I really appreciate all the experience and the help that you can give us. And if you have any ideas for where you think we should have a meeting, which community really needs one of those community meetings, can you please let me know so that we can go ahead and encourage, like we had to really push, like Alamosa said, yes, and use that place. And so if it's a place like that or any place you really would like to see us appear, that would be great. And if we could help us identify who the stakeholders should be there for the day meeting. We'd love to invite the ECC, of course. They'll be there, they're stakeholders. But if we can have you help us spread the word and you can help us know who we should be inviting, who those people would be, that would be greatly appreciated. And then maybe you can go ahead and help us, publicize the meeting, set up flyers for us in places you think they should go. That way you can help us spread the word in your communities. So the last slide, which is the next one, please, Monica. This next slide has to do with identifying what the best way is for us all to work together. CSCDHDB working with the ECC, and how we can share information best and how to do outreach. Maybe Google Docs, sharing documents, who we need to get a hold of. You guys can just add, people, give us ideas, and then later on down the road, when it comes time to start considering interpreting placed with the ECC, you can coordinate with us on that as well. And maybe, there might be other ideas and ways that we can collaborate with you and your program. With us and your program. And so lastly, I was wrong. There is one more slide. Sorry. My name, my email, my phone number, and please contact me for anything that you might have questions about. And I just want to turn it over to y'all to go ahead and, any of your thoughts, your initial ideas, things that you're just thinking, oh gosh, I need to talk. And I realize I took over an hour, and Stacy might want to hold any more information, and you can get a hold of me privately later. And I respect, that if you have time constraints. But if you're willing to spend a little bit more time and ask me right now, I'll just shut up and hand it over to you, okay?
Thank you so much. This is Monica. We are going to have to move on for the sake of time, but we do have a few comments in the chat box that say that they'll be reaching out to you. So we're going to move on to our next speaker.
Okay.
Thank you so much, Trish.
Thank you. I appreciate it. Bye-bye. Thanks, everyone, and I hope to hear from everybody.
All right,
thank
moving
you so
right.
much. All right, bye-bye.
Bye. We're going to move right along to our next presenter. We have Debbie Gray from our licensing department, and Debbie's going to talk a little bit about the level 2 in Colorado Shines. Debbie, are you there? And I will make you the presenter.
Yes, I'm here. Can you hear me?
We can.
Good. And then can I share my screen?
Give me a few seconds, and I will make you the presenter.
Okay. Thank you. So I did want to talk just briefly about level 2, but then I also wanted to just give everybody a heads up. In October, it's our Safe Sleep campaign. You may have already received this information, but the department, using some fine money that we had in the past, have been able to purchase Safe Sleep sacks for all home providers that have children enrolled under the age of 2. So we are actually receiving those today, and we'll be distributing them to our licensing specialists, and then they will be giving them to the family child care home providers. So just want to give you a heads up about that. And then before I talk about level 2, I did want to talk just really briefly, and hopefully everyone can see my screen now.
We can see your screen, Debbie.
Okay, thank you, Monica. Wanted to talk really briefly. This is not necessarily new, but with the use of, now that we are using Salesforce, we are sending out a lot more surveys. So after a facility, a home has been visited by a licensing specialist, they will get a survey sent to them by email, if their email is correct in our system. And I just wanted to ask the councils to really encourage the child care providers to take this survey. Believe it or not, we actually look at every single response, and we are working pretty diligently to improve our customer service skills. So question 8 is really important to us. And question 8 says, to what extent did you feel like your questions or your concerns were answered by your most recent licensing visit? So we are looking at that. We're doing some data analysis. We're trying to increase our responses on this. And of course, we want to see that they're at least adequately or fully addressed. The other thing I wanted to highlight on the survey is if you do have some feedback from providers that are upset or needing clarification on things, we do have a question on the survey that says, do you want to speak to a licensing supervisor? That is one way to, get our attention and to talk to a supervisor immediately if there's a situation that they're not able to problem solve with their specialist first. So I just kind of wanted to show you that first and really ask the the councils to help us with this to at least request that the providers take the survey. Our response rate is actually pretty good. Right now, I think we're at a 78% good response rate for customer service for question 8, but we're hoping to increase that to 82%. So the more people take the survey, the more valid our data is, the more information we receive. So just wanted to kind of put that out there, that I'm hoping that we can increase our response rate on our survey. Any
Debbie,
questions?
we do have a question. It says, where can we find the survey?
The survey is sent automatically out to the provider through our Salesforce system after a visit. I don't believe it's on our website at this time because we're trying to collect the information and organize it based on what type of visit they had, which is one of the questions that we have on our survey as far as what type of visit. So right now it's not on our website. If it's a possibility that we could put it on our website if the providers really don't receive the link. But if they don't receive the link to the survey, they can reach out to their specialist and we can try to problem solve. There was a small bug in Salesforce that it was sending it for the child care facilities, sending it to the director. And if we didn't have the director listed in Salesforce, it's not really a bug, but if we didn't have the director listed in Salesforce and the current email, they weren't receiving them. So if they don't receive the survey, they can let their specialist know.
Debbie, can you send a copy to us and we can send it out with the follow-up items for the webinar?
Yes. And then question 7, actually the councils can help me with this as well. We've been collecting information on what providers feel like they need more training opportunity on or more information on. So question 7 is just asking, do you want more information on Safe Sleep, on Colorado Shines, on PBIS, Quality Improvement Grants, TEACH, mental health, healthy childcare? So what we're doing is just kind of analyzing this data right now and figuring out what our biggest requests are for training. And then we're hoping to get the licensing specialist a little bit more information on that, as far as maybe some just one-pagers on who to contact or what different programs are. So we are actually working on that as well, and any feedback to that I would greatly appreciate.
So we do have a few questions, Debbie. It says, would that connect them with a state licensing supervisor or local licensing supervisor?
Oh, great question. That would connect them to the state supervisor. So we have someone in our office who looks at this survey usually twice a month. We don't have the capacity to look at it more than that, but that may change. But right now we look at it twice a month, and when she sees that survey come in for the month, she'll forward it to the state supervisor. If the state supervisor can't assist with that, then we'll reach out to the liaison, then we'll reach out to the contract supervisor.
And how long after they submit the survey will they typically be speaking to the licensing supervisor?
Another great question. So right now, because we're only able to check the survey about twice a month, I would give it at least 2 weeks because the supervisor may not have even been alerted to the fact that a program is requesting a call. The other thing that we've seen is sometimes providers will check this box and then not give us their phone number. Originally this survey was anonymous. We did very recently include question number 1, revise the survey to include it, which is what is your license number. The reason we have done this is because we're trying to collect more data, more information to find out, is our customer service rating a little bit lower when it's a complaint investigation? Anecdotally, we may know the answer to that, but we're trying to collect that data. We're also wanting the licensing number to know if possibly camps have a lower, customer service rate, or maybe it's home providers or child care facilities. So we're trying to also figure out more information on that data. So if they don't get their phone number on question 10, we can usually figure it out now, but this is a new addition to the survey that I just added in the last 2 weeks. And I'm just pausing for a minute to see what questions we have. How can we have it?
Another question is, how often
okay, yeah.
do you see it? How often do you send the link to the provider after the visit?
It is automatically sent out. Salesforce sends it out in an email after every visit that has been done and logged into our system. So every time a specialist goes out and does a visit, we have a place in our new database that stores the report of inspection, and they put in a contact date, and then a survey is generated. So some of it could be duplicate, and that's the other reason that we're asking what type of visit it was, because at this point in time, we're really trying to focus on our supervisory visits. Those are our longest visits, where we hopefully are there the longest and give the most information.
Thanks, Debbie. That's all the questions for now.
Okay, thank you. So I'm going to switch gears here, and we're going to talk a tiny bit about level 2. We have had a couple of questions lately about how specialists are notified regarding level 2. So I'm sharing my screen to show you a report that generates from our Salesforce system. I don't know if when you see my screen, oops, that's not what we want. Hold on. Sorry. This is a report that the licensing specialists receive every Monday, and it tells us across the state what programs have submitted. And then as we scroll over, it tells us if they've completed all the level 2 activities. Trying to minimize
and
this box so you guys
just a reminder to the councils, you guys have access to this report as well.
Oh, good. That was a question of mine.
It should look familiar.
Okay. So it basically is a report that tells us if they've completed all those activities. So if there's a 1 next to something, that's an indication to us that, yes, this program has included all activities. Right now, I can't seem to scroll all the way over to show you the rest of this. Monica, can they see the whole go-to webinar when I'm talking, or just my box? Just the box?
We can see your the full screen.
Oh, so maybe you can see it and I just can't. Can you see all those indicators on the report?
Yes, all the way to program self-assessment complete.
Yes. Okay, good. So when a program has 1s for all of those, that is when we request that the specialists do the L2 audit, which is done in the office. And it's basically looking at the account, looking at workforce, looking at all of these things listed to make sure that they're complete. A question had come several times, which is how often does the specialist do this, and how much time do they have to award a level 2 once the report indicates that a program is ready. So again, this report comes out every Monday. We have requested that the licensing specialists do this within 10 business days, which gives them 2 weeks. If that does not happen, we recently became aware of kind of a bug with the report, and that was fixed. But originally, we did not have it in the report for L2 programs that were actually re-rating or reapplying. For some reason, they were not showing up on this report, and the specialist didn't always know about them. So when that happens and the council knows that, boy, this is taking forever, I want to encourage the councils once again to reach out to the specialist and let them know, or the provider themselves. If that, after 2 weeks you don't get any response, or you don't get the level 2 approved, then you can reach out to me. I'm the coordinator. You can also reach out to the Colorado Shines Help Desk, and they relay the information to me. But we always want to ask that you reach out to the specialist first, because it really could be that he or she is not aware this program has submitted. As you all know, we've had a few bugs and complications with our Salesforce program, and occasionally we find some programs that weren't listed on this, and then we ask our Salesforce team to go back and make sure the report is pulling the most accurate data. The other thing maybe I'll pause there. Any questions on that part? And then I wanted to show you a section in Salesforce where I've asked the licensing specialist to document things when they have reviewed the application, so that way the councils can see, and I can see, and the help desk can see that a specialist has actually looked at this application and maybe it's not quite ready to be approved.
We do have two questions. The first question is,
okay,
what's the name of the report? The name of the report is L2 Waiting Approval, and it should be in the ECC folder. If you have access to Salesforce, go to Reports, and then there's an EC Council folder or ECC folder, and you'll find it there. It's called L2 Waiting Approval. And then the next question, Debbie, is what follow-up is provided when L2 has been submitted with not all the steps, when not all of the steps have been completed?
Great question. And that's the next part of what I wanted to talk about. So one of the things that we've been doing, and this is why I wanted to share this with the council so that you all have this information. So now on my screen, I just put, and this particular provider just applied for a license, so she has not submitted anything for QRIS, but I just wanted to use this account to show you where you could go and look and see when a specialist has reviewed an application. So as you know, this is under the QRIS account, QRIS application. If you scroll down to Program Qualities, which is the one that's got the little Lego, I believe all the councils have access to this screen. If you click on here, this is where a licensing specialist would go in and change the rating or award a rating when they're completed. What I've asked licensing specialists to do is once they review an application, if they are unable to approve it, I want them to log it in this activity history. I think this was a screen that possibly, Monica, you guys were using originally for the help desk where you were logging information. Is that right?
That's correct, but the councils never used that.
Can they see this? It was my understanding they could see this screen.
They should be able to see the activity history, yes.
Okay.
And we
that
do
was
have
our
a
original
question.
intent.
Yeah, we do have a question I want to address. It says, we have 5 providers that are on the report, but none of them have completed the requirements for level 2. Why would they be on the report at all? And it's most likely that those programs just submitted for a level 2. The system will let you submit for a level 2 if you have not completed all of the requirements.
Correct.
Go ahead, Debbie.
And I do want to know about those. So when we built this report, I did ask to include programs that were only partially done, because a role that I want our licensing specialist to take on is that of an ambassador and someone who encourages the level 2 process. So I've asked the specialist to look at this report weekly, even though they may not have a program that's completely done. Maybe it's just one little thing that they need to finish, or maybe they need to check a box. A lot of times providers forget to check that they're completed and submitted. And a lot of times I found through going through applications aren't quite ready, is that all they need is just a little bit of help, a little bit of encouragement, and maybe a phone call, and they can be ready. So we do want the information to see kind of the progress, and when we go out to do a home visit or we go out to a center, we are asking the specialists to talk about their Colorado Shines rating, especially if they're still at a 1, in hopes to get them to a level 2. I'm checking to see if we have any more questions here before I keep talking.
We have one more. It says, can licensing specialists follow up with providers who only need a little bit more help? Currently, I'm having my coaches provide these final follow-ups.
Yeah, so it's my understanding it's kind of both our roles. So we definitely want to work with the council and we want to work with the providers. And so that is exactly what I've requested the licensing specialist do, is to look at this report, log here under activity history, just click log a call, and we can kind of give a narrative here and the date as far as, what we've done so that the councils are aware of it too. But yes, that is exactly what we're wanting to see is once the specialist has reviewed the application and maybe they need, one more hour of PDIS level 2 training, we want the specialist to reach out to the provider, let them know why they can't approve the application, let them know we've definitely seen it, we've definitely reviewed it, and explain to them what they can do to become level 2, and then document it here. The other thing that I try to do, and I try to do it weekly, is I go through this report myself as well. And when I see that programs have all of these indicators checked, I will, in the past, reach out to the specialist to ask them for an update. So now I go in first to see if they've documented anything. If they haven't, then I'll send them an email and say, give me a status update. To be honest, I was doing this more frequently than I have been lately because of all of our issues with Salesforce has taken up a lot of my time, but things are becoming a little bit smoother on that side, so I'm going to go back to looking at this report weekly.
And that's all the questions we have for now, Debbie. And we are running out of time. We still have our CCR and our presenter. Thank you.
Okay, yes, thank you. That's all I have. I appreciate you giving me your time.
Thanks so much, Debbie. We have a question that just says, should coaches list their contacts?
List their contacts where?
Oh, in Salesforce as well. No, and they might not have, no, coaches won't have to do that, and they might not, yeah, they might not be able to access, they won't have access to that piece.
Okay.
All right,
okay.
Thank you so much, Debbie. And we'll follow up with the link to this report as well in case you missed out on finding it on your Salesforce page. We're going to move on with Elizabeth Navarez. She is the manager over at the call center that does the Colorado Shines Child Care Resource and Referral. Hello, Elizabeth.
Hi, I am trying to show my screen, but I don't think I can. Monica, can you help me?
I just gave you access.
Okay, perfect. Can everyone see my screen?
Yes, we can.
Okay, perfect. So I just want to give you updates about what's going on our side. The first one is provider closure. So there was a center closure in Boulder County that happened early August. And Robin, she did a great job. Right away, she told me about the closure, and I alerted our navigators, our childcare navigators about it. And then she alerted providers about availability, which is something great. Providers were very responsive, and they right away sent information about their spaces available, which helped us tremendously when helping families find a childcare provider right away. So thanks so much to Robin and Boulder County Childhood Council. They're doing a tremendous job. The next section that I have, we have a new web page. Let me go ahead and try to access that. Can you see it right now?
Yes, we can.
Okay, perfect. So this is a brand new web page, and if you scroll down, so first off, it has information about what we do, who we are, and then further down, it has contact information. So it has the 1-800 phone number, hours of operation. It has a chat function. People can, chat with us to find childcare. They just have to click on this small link here. And then if they don't have time to call or to chat, they can always email us their questions. I'm working right now on putting in an intake form that they can fill out so that they can send us their request for childcare.
Elizabeth, will you scroll back up? I like that you're slightly famous on there, and it's always nice for people to kind of see who's speaking. So just this picture up here, that is Elizabeth that is presenting right now.
Yep, that is me. All right, and so this is our webpage. Feel free to put that on your websites or give it to your, your families that you're helping. We're more than happy to help them out either through our chat function or answering emails. And then, of course, we also have our live call function. So we can help families through a lot of modalities. The next section that I have, Larimer Childhood Council is interested in shadowing our work, which is very exciting. So right now we're working on dates that they can be here, sit down with a navigator, listen to a call, and just kind of see what happens on our side. What are the steps that we follow in order to find families childcare? So that's very exciting. If you are interested in coming down to our contact center and shadowing our work, I would be more than happy to work with you and set that up. And then the next slide that I have here, it's our survey slide. So this is our July survey. So far, we have 22 people that we have surveyed. We are 73% completed. We have until the end of the month to collect those responses. And so far, these are the responses that we have compiled. 64% of families were able to find childcare. 36% were not able to find childcare, and the majority of those are due to no availability. 9% they chose FFN, and then 27% they haven't started searching for childcare yet. 95% of callers rated the quality of our service as good or excellent, and then 100% would recommend our services to a friend or family member. Last time that I presented this slide, there were several of you that were interested in receiving this data, but for your specific area. I am working with our reporting agent, and I'm not sure if it can be accomplished. I'm hoping that it can, but I'll give you an answer as soon as I know how we can accomplish this, or if there's maybe a workaround for this data. But thank you for reaching out, and I love that you are interested in our work and all the all the data that comes from helping families find childcare. This is pretty much what I have for today. Do you guys have any questions?
We do have one question, Elizabeth. It says, I would like training on how to better search the database when we have calls. I'm sure there are easier ways to gather this information.
Okay. I'll be more than happy to talk more about this with you. If you can email me, that would be great.
Great. Then there aren't any more questions for now.
Okay, perfect. Well, thank you very much for your time. And if you have any questions later on, feel free to email me, or you can also give me a call. I'll be more than happy to talk with you.
Thanks so much, Elizabeth.
Perfect. Thank you.
All right, moving right along. We're going to share our most recent CSTAT WIG data with you. And I think there's a delay on the screens. Hold on. Oh. Okay, here we go. So hopefully this looks familiar to you. Quan presented on this last State TA Day webinar, and it's that wildly important goal that we're trying to achieve by, well, we have it's kind of broken down with 2 dates. First, we're looking at December 2018, and then we're looking at June 2019. So our goal, which you will see we have achieved, our goal by December would be 23.1%, with our end goal at 23.5% by June. Since the early childhood councils are overachievers and have already met the goal that was not due till December, we've had our executive management kind of send us back to the drawing board to achieve a new goal. So right now we have our data team looking into some past data and trying to predict what would be an achievable goal for us. So stay tuned. We'll probably present on that next TA Day webinar. And if you haven't had a chance to check out this data, the link's available. We will send it out again, and you can sort it out by your early childhood council. This, what we were just showing, was the entire state. Does anyone have questions about this slide or this Google form? We have one question. It says, can the new WIG goal created be aligned with funding? That could be to be determined. Oh, and we have some comments that say it looks great. That's from Phil, that knows all the guys down in the basement here that actually created this. So thanks, Phil. But otherwise, does anyone have any questions about anything else? I know we're scheduled for an hour and a half, but we did kind of go a little bit longer than usual today. So we'll give you a few seconds to type in the question box. Otherwise, just reach out to Michelle, Karen, or myself with any questions or anything you want us to follow up on. We will send out everything by Monday that was presented today. That includes the recording. And everyone's probably, I was going to mention this during the beginning of the webinar, but Emily did have her baby last Thursday, August 16th. And she had a little boy named John Charles.
We're going to send this out, but you can get me, if you want to do my screen.
Oh, okay. And I will show you that picture right now.
You have to.
Okay, Karen's going to forward me the picture and I'll share it with everyone. And we'll send it out in the email too. And people are wanting to send cards. You can just send them to the OEC, and then we will send her the whole bunch of them to her house. Thank you very much. Did I get that, Karen? You send me the...
Just take a minute. Just keep refreshing. Sorry. It just hit me because we're actually going to send this out in the week.
Oh, okay. We are sending the picture out in the weekly communications. Okay, Karen, you can show your screen now with the picture of the baby.
Maybe.
So here's a picture of Emily's baby, and just like I said, reach out if you guys need have any questions or need any support from us.
There we go. Now we can see him.
Oh my God.
Baby. You're so goofy.
Mommy and Daddy.
All right. Thank you guys so much. Have a great rest of your week.